Welcome everyone to the ACRS webinar titled The New National Road Safety Strategy 2021 to 2030 and the Social Model Approach. My name is Susie Chan and I'm moderating the session today. We have planned to go for 60 minutes with time for questions. We would love to have your input, so see here on the slide how to submit your questions. Feel free to submit questions throughout the session. Now, we are following the government guidelines and are all coming from our home offices, so fingers crossed all our technology works. We also have Isabella and Neva from ARRB joining in for technical support. Our presenters today are Dr. Jeff Potter, Victorian Chapter Chair, ACRS, and Gabby O'Neill, Head of the National Office of Road Safety. Okay, let's get started. We'll now be hearing from Jeff.
Thank you, Susie, and good afternoon, everyone, and welcome to all the members and non-members of the college from across Australia and New Zealand. Today's webinar is being presented by the Victorian chapter of the Australasian College of Road Safety, and I'd like to begin by thanking ARRB, who are hosting the event, and particularly thank college members Tia Gaffney and Dave McTiernan of ARRB for their efforts in setting up the event today, as well, of course, of thanking all of you, now well over 100, who have joined us to participate in this session. We'll be hearing today from the head of the Federal Office of Road Safety, Gabby O'Neill. They'll be describing the work that's underway to develop a new national road safety strategy for the coming decade, and she'll be telling us about the social model approach that involves how we can reach beyond traditional transport agencies to leverage broader sectors of the community to improve road safety. After Gabby's presentation, we'll be taking questions, which, as Susie says, you can type in using the questions tab on your screen. And please do feel free to send those in as they occur to you during the presentation, rather than waiting for the end. Now, as I said earlier, our speaker today is Gabby O'Neill, who's a road safety leader and since November of 2019 has been head of the Federal Office of Road Safety. The office is responsible for setting the direction of road safety through the National Road Safety Strategy, administering funds to develop innovative road safety practices, and embed safe systems thinking into infrastructure investment. Key to the office's success is building community acceptance for known road safety solutions and the penetration of road safety outside of traditional transport agencies. This role follows 9 years in road safety and change management for South Australian Government and 7 years in safety policy and residential tenancy legislation for the New South Wales Government. So without further ado, I will welcome Gabby and pass over to you to tell us about the new strategy. Thanks.
Thank you, Jeff. Appreciate that. Thanks, Susie. If I could just thank everyone for joining us. I'm really pleased to be involved in today's webinar, and today I'm speaking from the land of the Kaurna people, and I acknowledge and pay my respects to elders of the Kaurna region, leaders past, present and emerging. And I also offer my respect to all First Nations peoples participating today and those providing care for country and care for community in road safety programs across the nation. For those of you unfamiliar with the Office of Road Safety, we were established last year as a result of the inquiry into the road safety strategy to provide national leadership and coordination to improve road safety outcomes. One of our core pieces of work at the moment is developing the new National Road Safety Strategy for the next decade. And we're also the Australian Government's key policy advisor on road safety and responsible for influencing, developing and implementing a range of initiatives and funding programs designed to improve road safety across Australia. For example, the $12 million Road Safety Innovation Fund and the $4 million Road Safety Enablers and Awareness Fund. Thanks, Susie. Next slide. As I say, our core focus at the moment is developing the new National Road Safety Strategy for 2021 to 2030, working closely with state and territory governments and the Australian Local Government Association. It's really about delivering a new national strategy to address the most critical road safety issues that will make a difference over the next decade. And this includes defining a discrete number of policies to focus on, particularly in response to the findings of the national inquiry. We're doing this to ensure that the national focus is on the most important issues and where we need the most change first. We're also addressing the governance, accountability and transparency issues brought out by the inquiry and the subsequent governance review. Transport ministers have considered and agreed to some key parameters for the strategy's development, a long-term goal to position Australia to achieve the Vision Zero target by 2050. The strategy will be underpinned by safe system principles and framed around three key themes of safe roads, safe vehicles and safe road use, with speed to be considered within each of the themes. Separate targets for fatal injuries and serious injuries will be explicit and defined as a percentage per capita, recognising the upward pressure of population growth and also where we need to focus most. And to date, our key policy priorities have been tested through a consultation process during July and August. We've met with over 50 stakeholders from vulnerable road user groups, heavy vehicle organisations, road safety researchers, national road safety advocates, as well as broader groups like health and Indigenous representatives. We also had submissions and engagement with the Australian College of Road Safety, who made a really valuable contribution through the President Martin Small and CEO Claire Howe, and we thank them for their contributions and the ongoing dialogue we're having with the college. Overall, we've had broad agreement on the proposed set of policy areas, but we also received key points for consideration around issues that came up in relation to the inquiry and the governance review. We're also taking on board those key points for consideration within the policy areas and refining our focus and how the strategy will eventually develop under those policy areas and how the policy areas connect to one another. Next slide, please, Susie. The strategy will take a new approach in its delivery, recognising road safety is not solely a transport or solely a government problem. We know that we need long-term cultural change and attitudinal change towards road safety. We know we need to make road safety business as usual in all local and state road authorities, as well as in fostering a road safety culture across Australian society. So what we call the social model approach may be better known to you as the social ecological model, and it was developed in the 70s by sociologists and has been used in areas of health and criminology to support better outcomes. It was presented at the ACRS conference last year, and when we knew that we needed to look beyond traditional transport solutions to encourage and support involvement across multiple sectors in government portfolios, we were encouraged by its application in other areas. Road safety itself cuts across health and social service sectors to law enforcement, education and justice, planning and industry, and resonates across all levels of society, from organisations to individuals. The social model is layered with the individual at its heart, and it expands from responsibility for an individual's own behaviour to their ability to influence other individuals and organisations, to organisations actively prioritising safety, community influence and advocacy, through to systemic change across society. If I can just reiterate, the strategy is underpinned by safe system principles, and the application of the social model is complementary to and not instead of the safe system approach. It's also not about blaming individuals, but instead roping in a broader sector of society to achieve change. You can see the layers on the screen there of the social model, and the system public policy layer is obviously where the office sits and where transport and road agencies sit. Governments at all levels to provide regulation, develop and set policy, target their funding and investment, their delivery of infrastructure, public transport provision, and ensuring the laws and government managed systems are geared toward preventing death and injury. The community layer focuses on advocacy and addressing issues from a grassroots level led by community organisations to create change. At the organisational level, we're seeking road safety as a priority for firms, businesses, agencies, organisations of all sizes, for example, by putting in place policies and systems to ensure safe road travel, or even deferring road travel and instead making use of alternative meeting types. Although I'm sure many of you are actually looking forward to those face-to-face meetings and connecting once again. The interpersonal layer is about leveraging relationships, including at individual, organisational and sector levels, to preventing injury and bringing safety front of mind among one's realm of influence. We often see this at the CEO level or at high officer level, and how people engage with each other to bring others on board. At the individual level, I think we recognise that we all have different starting points. And what resonates within each of us might be very different, and it's often said it doesn't really matter what the science says if I already have a strongly held belief or opinion. So understanding this is very much part of the logic behind the layered social model approach. We're trying multiple touch points to gain resonance where it might matter most to the individual through work, the sports club, community engagement, motoring club, scouts, whoever those influential voices are in a person's circle. How do we tap into those to create change and create cultural change? So while individual responsibility for road safety and the use of influence to foster change is key, particularly among a group of professionals and road safety practitioners such as yourselves, we know that each individual using your skills, knowledge and experience to advocate, create change and establish new norms within your own personal realm of influence is doable. But we also need to remember for other individuals, their context, environment, and without the benefit of professional knowledge, their existing influences might be entirely different and road safety not even on their radar. Next slide, please, Susie. So influence is the key factor in the social model approach. It's about using one's own tools and involvement to influence outcomes and result in broader road safety awareness and benefits. At the government level, it's about fostering a whole of government approach to bring in a wider group of portfolios and agencies, such as health, social services, education and industry. But it is also about driving road safety outcomes at all levels of society, including through local governments and community-led approaches. To assist with this from a local level, we're looking at undertaking some further targeted engagement with local governments and communities, in particular Indigenous communities, to understand road safety challenges and barriers from their perspective and how to best apply the social model approach. So we know that within Indigenous communities, it's unlikely that a bureaucratic approach will make any difference. Whereas if we work with trusted community members to understand the issues, raise awareness and deliver specialised programs with the support of the local empowerment of their own community committees, that we will get better safe road use. So part of our thinking is about reaching into the authorising environment of Indigenous communities and allowing government to be guided by their communities into successes. Another example of advocacy and change at the community level might be through local influential organisations such as sports clubs. These organisations can use their influence to encourage road safety, such as through having a road safety policy for club-associated travel, especially on game days, and championing good road safety practices at the club with zero tolerance for drink driving across all levels, and having senior players and extended families modelling the right behaviour, being prepared with a plan B when they intend to drink. I don't think we can underestimate the influence that the local footy clubs, sports clubs in general, have on players and members. So if we can influence those in a general level, we can reach out further because they may be the voices that our individuals are tapping into. So the social model provides an additional layer to support road safety action, working alongside the priorities and the safe system approach to allow us to systematically reach where perhaps in the past we've only had a light ad hoc or accidental touch. We want to change that and move into a systematic approach so that over time, I know that we're only at the very start and emerging phase of the social model, but over time we will be able to reach out and broaden our influence across in a very systematic way so that by the as we get to the end of the life of the strategy, we've got reach into a greater number of communities. Next slide, please, Susie. And particularly for Victoria, we did pose the question, would any presentation be complete without mention of COVID-19? We have emerging trends in transport options and need to consider their potential impacts on road safety. We've already seen an increase in the proliferation of micro-mobility devices on and around our roads and on adjacent paths. Over the years, we've seen the take-up of pedal cycles and pedal cycles boosted with electric motors. But in the past few years, new devices have come into the market, such as electric scooters, skateboards, and other devices like hoverboards. With COVID-19, what we're seeing and perhaps to expect to see more of is more people on these kinds of devices as a form of active and alternative transport, and in some ways as a reaction alternative to public transport. In addition, the presence of vulnerable road users associated with the gig economy, if we're thinking of people that are doing food delivery by pedal and e-bikes, the numbers are exponentially rising and likely to be exacerbated during periods of lockdown and restrictions. The impact for road safety is likely to result in greater numbers of conflict points as people avoid public transport, and with an ever increasing number of cars on the road with fewer occupants coupled with more vulnerable road users and a potential increase in fatal and serious injuries as a result of crashes between motorised vehicles and micro-mobility devices. So this is front of mind as we're developing our strategy. How are we going to keep ourselves adaptable and flexible enough to deal with disruption? Next slide, please, Susie. The next steps for finalising the strategy, now that we've got a set of parameters to support the framework and have sought our initial stakeholder views on the priorities, the detailed work is underway to finalise a draft strategy and first action plan. We expect those to be considered by transport ministers towards the end of the year, and we expect or anticipate there may be further opportunities for consultation as the strategy is developed further. I expect the final strategy and the first action plan will be approved sometime in early 2021. Next slide, please, Susie. That's really the bulk of my talk today. I wanted to leave sufficient time for questions. If you're interested in our work and would like to stay informed, I welcome you to visit our website or get in touch via email. The details are on the screen. We also have a monthly newsletter for our road safety stakeholders, which I encourage you to sign up for. And now I'll hand back to Jeff, and I'm ready to take questions.
Thank you for that Gabby. That was a very good coverage of the direction the new strategy's taking, which I certainly found interesting. A number of questions have come in, and I might start with a couple from Adam Gibson, sort of scope questions, if you like, about the strategy. The Vision Zero to eliminate harm on Australian roads by 2050, which was a very strong encouraging position for ministers to take. Is that including intentional acts? And when you're looking at targets for fatal injuries, are you including all fatal incidents, or are certain deaths going to be excluded? I guess this is addressing the issues of how we treat suicide and suicide attempts in the road toll.
Thanks, Jeff. Thanks, Adam. I think I'll answer it in two parts. So when we're talking about intentional acts, I think there are two types of intentional acts, and that's intentional reckless behaviour, often called extreme behaviour, very high risk, but intentional disregard for the law, and separately intentional acts for self-harm that result in suicide. So in the first instance, intentional acts as in intentional disregard for the law, I think our strategy is really more focused on the bulk of the population and not the very extremes. So we have, when people are engaging in intentional disregard for the law, we're really looking at the criminal code and criminal law to deal with that. And our strategy is based on drivers in the system that are, we would say, generally, inherently abiding by the law, that are making mistakes. The intentional reckless driver that's driving at 160 kilometres an hour, the strategy is never going to capture that, but we are seeking through, I suppose, criminal codes and enforcement for compliance around having, beefing that up as part of the strategy. But the strategy itself doesn't deal with those very excessive high-risk behaviours. The suicide question, at the moment, suicides are not included in the road toll. And looking at the numbers, we notice that the trends are relatively stable, but we do have questions around, is that because we're not recording in the road toll, is there a level of under-reporting? We also know that if they're not included, we don't necessarily have a policy response to it. But we're at the moment trying to focus on the highest crash types and those that result in them. We're really focusing on what we can do with the highest crash types, and the numbers that we know that are suicide and removed from the road toll are relatively low. So they're not the biggest area of focus or importance for us at the moment. We also know that there is a national suicide prevention plan, and I think it's our long-term goal to make sure that we're aligned with that. I think the short answer is this strategy at the moment, at this stage of it, is not dealing with suicide crashes, intentional suicide crashes at the moment. That may change, and we're looking for evidence to support why we would push that up into an area to focus on and reduce other areas of focus. As I said earlier, we're trying to keep the number of policy areas discrete so that we can focus on things and go into them with depth rather than spread ourselves too thin, which was a criticism of the past. I hope that answers the question for you, Adam.
That's good. That's good. Thank you, Gabby. Another couple of questions relating to speed. So when you're talking that speed's going to be considered within each of the safe systems areas, do you mean speeding? There's another question Adam's asked, and if not, what speed interventions might look like, and the extent to which enforcement effort is involved to speed improvement rather than speeding improvement.
I think we're looking at speed management. So speeding is sort of contravening the law. You're breaking the law when you're speeding, and that's when we would expect enforcement to kick in. But speed management as a rule is something that has been, or not so much speed management, but within speed management, there's a whole number of sectors that play into it. We've got the default speed limits, we've got the self-explaining roads, we've got enforcement, we've got types of detection, we've got deterrence, we've got speeding. And what we're trying to understand is what's our speed management policy? What's the big policy question around speed management? What is right for the context of the Australian conditions and what applies when? So we want to build speed management and make sure that speed itself is self-explaining and takes into account injury prevention. And I think that is outside of the speeding question. When you're speeding, you're breaking the law, and that's when our enforcement needs to kick in, as well as cultural change. So this is where the people driving around you don't accept that it's okay to speed. So passengers in your vehicle, your family members, your broader community are all pushing for people within this realm of influence to say speeding's not okay, not even a little bit. So I think that's part of the culture that we have to address. The speed limit is not a guide, but it's the top posted speed limit. And so we need people to abide by that and also have a strong enforcement to back that up. And I think that's also part of what we need to do. We need to make sure that when people are speeding, that one, they are caught, two, they know that they are caught straight away, they expect to be caught, and that the sanction is swift and enough to make them question doing it again. So that's the theory behind deterrence, and us getting there is probably we need a greater emphasis on enforcement for speed. I hope that answers it, Jeff.
Thanks. Yeah, thanks, Gabby. I think there's a number of questions about speed that will come up during the course of the session, no, that was good. A question from Adam Malarski, and my apologies for not pronouncing your name correctly, Adam. We need to champion and embed road safety into local government, and 550 odd councils around Australia that manage about 80% of the road network. So this needs training of local government practitioners in road safety engineering across council, not just the roads area, but the other areas within council, to assess why road engineering is important to their community, and not just reactive black spot projects, but proactive and predictive actions. How will the new strategy address that task, and who's going to do that sort of work?
Thanks, Adam. Oh, you're absolutely right. We do need to champion road safety into local government. I'm talking at the moment with local governments, sort of a mix of councils across the nation. We had some talks this week with metropolitan councils, and next week we're talking to regional councils along with a remote council put in there. The biggest influence for local government is generally the state government body that sits above them. They're very influential, and the Commonwealth is often seen at arm's length. But what we are trying to do is really get a network-wide road design plans, network safety plans for all road authorities, which includes local government. I know that that will take time, but if we can do that for our state governments, we are hoping to influence that as a way to bring local governments on board so that they understand, one, what does their network look like? What do the gaps look like? And what, over the next 10 years, what would their investment plans look like in order to reduce risk? So that certainly addresses the proactive approach, and it looks at corridor lengths, not just gaps or spots, but it looks at how do we get greater homogeneous sections on the corridor, and how do we reduce the risk level along the length of the corridor. So that's certainly the approach that we're going to take over the life of the strategy. It's going to mean a new piece of work, and most likely will be one of the enabling actions in the first action plan to pull that together it will be a significant project. You're right, there's 538 councils across the country. So how do we reach out to each and every one of those? So I think one of our first enabling actions is actually scoping up the project on how to do that, how to undertake network-wide safety plans, and how do we train and bring up the capability within local government. So that's very much a focus for us, and I think we will see great gains when we get there. Back to you, Jeff.
Yep, sorry, just having to remember to press my mute button. Thank you for that. Got a question from Georgia Simmons, who's CEO of the Fit to Drive Foundation. That's a leader in providing road safety education to young people. And her question is, how does the strategy apply to young people? They're overrepresented in road trauma, and you haven't specifically mentioned them so far, but how are you planning to target that particular group?
Thanks, Georgia. Thanks, Jeff. I think probably through our vulnerable road users priority is where young people feature most, either as young drivers or being a passenger with other young drivers, and also as children from 0 to 15-year-olds, and how are they restrained in vehicles. In regards to driver training, it really is around the graduated licensing system where we've had the most success with young people. And so that's under 25-year-olds, and putting them through a series of training to gain their license, where for a start they're highly supervised with a high level of restrictions, and as they gain competence and confidence, the restrictions are lifted. And it's really, how do we get a graduated licensing system consistent across the nation, and how do we get everyone into that sort of system? But that is certainly where we have had the most success. And I think for us, we'll be continuing that and focusing on how can we get the whole nation signed up to the same level and rates of sort of restriction, and then release of restrictions over time to get a greater cohort of drivers. I think we don't have a silver bullet, but that is where we'll have our focus in the strategy.
Okay, thank you. Question from John Keys is, one of the key themes in safe road use and the individual function element of the social model refers to the capacity, skills, knowledge and experience. So is there also a consideration of how to build positive road safety beliefs and attitudes? And beliefs and attitudes we know drive the associated behaviours, given that we need a long-term cultural change towards road safety so that it's business as usual. So how do we foster that road safety culture across Australian society?
Thanks, John. Thanks, Jeff. Look, I have had a look at how do we have a positive model? How do we show, what's the, what's the 5-star model of driver behaviour, or the positive reinforcement of good driving behaviours? And as I've talked with international colleagues, it's been really difficult to get away from, we don't want to blame the driver, and we need to be really conscious that we don't turn it back into that blame game. And so I think we're really clear that where we can influence is probably through the things that matter most to people. So through employment, through opportunities, through leadership by people they trust or look up to. And I think the cultural change is really going to take us 2 generations, so which generally equates to about 30 years. So from where we are now, I think it is in reality going to take us to 2050 to get that cultural change. We've achieved it, you might say, in large part with sober driving. When I was a younger person, we all knew not to drink and drive, but it wasn't the reality. We didn't have other options for transport. We certainly drank far too much, and we certainly drove. but the idea of a young person doing that now is probably quite out of the question. It's not a consideration for them. We have over time seen change with the public education campaigns, with the evidence and the research and the graduated licensing scheme. Younger people are not going out to drink and then drive home. They already have their plan B, they have their Ubers, they have their taxis. Drinking is not the same focus in the culture that it was when I was a younger person. So cultural change can occur, and I would say we're just at the very beginning of that journey. And, you know, we know where we want to get to, and we have to plan our way through to getting there. And I would say we're really at the infancy of starting that process.
Thanks, Gabby. There have been a couple of questions come in around education, training, and young drivers. Questions about, is there going to be a graduated licensing system for motorcycles? Is there something that can be done about the quality of training that novice drivers get during their compulsory 120 hours of pre-licence training? Is there a role for the driver training industry and also for work health and safety training in this broader social engagement to use influence on improving safety outcomes? That's quite a diverse range of issues, but all tie into that education, training, development of early road safety attitudes. I wonder if you could address that.
Thanks, Jeff. If I start with the motorcycle GLS, a graduated licensing scheme, I think there is a broad agreement that a national graduated licensing scheme for motorcycle riders, sort of a best practice framework or a national framework, is certainly somewhere that we're looking for, so that all states and territories can pick from what we know is best practice, or at the moment, like they did with the driver GLS, and sort of focus their parliaments towards what's best practice and then what can they pick up. So we'll certainly go along the lines of looking at what's best practice, what are the frameworks we can implement over a number of different schemes, and motorcycle riders is one of them. So we certainly do intend to go down that track. As for the role of driver training and young people learning to drive and the pre-license training, the 120 hours, so we know that at the moment there is not a single rule across the country. There are multiple differences in all of the graduated licensing schemes for young people. And I think at the moment we're finding that the graduated licensing scheme is working well and as intended. So we haven't gone out to change that significantly. It wasn't an issue brought up in the consultation. It was more around how do we just keep pushing states and territories to get all of the elements of the best practice system into their schemes, so that we can get a more harmonised approach and get the highest number of states and territories closest to all of the best practice rules. As for work health and safety training, there's a huge push to elevate vehicles as a workplace. And we do understand that of work-based fatalities, that 62% of fatal deaths in the workplace were as the result of a road crash. So it's something we're taking very seriously. And to have vehicles and road safety policy as part of work health and safety, we think is a critical factor and a really good demonstration of how the social model will work in practice. So it's around multiple levers. So organisations may not go into it for the road safety benefits, which is obviously what our focus is. They may go into it to reduce the cost of claims. They may do it to improve their reputation as a PCBU. They may do it because they see that as a risk to their organisation as part of their risk assessments and work health and safety. They may want to just reduce the time lost for injury in their workplace. And so road safety will benefit when we have these linked and tied. So the outcomes are aligned, and it's just using both of those together to get us to where we want to go. There's a significant amount of work already done through Ausroads, and we've had some organisations such as the Master Plumbers, etc., take that up in Queensland to get vehicles as a workplace across all plumbing firms in Queensland. It's been very successful, and going right down to individuals using their vehicles, getting to and from the workplace, carrying their tools, etc. So we've had a lot of success there, and it's that type of model that we're trying to replicate and embed for all firms. Pass back to you, Jeff.
Thanks, Gabby. Yep, thanks, Gabby. A question from David Williamson, which deals with one of the unfortunate realities of working in the public space. The funding to do anything is likely to be severely restricted over the next few years because of the impact on COVID-19 on the economy and on all of us. How is that going to be addressed in the next action plan?
Sorry, I had a delay.
Gabby.
Yes. Can you hear me now? Hopefully yes. You can hear me. Thank you. Look, I suppose that's not a question that I can answer directly, David. You know, we're doing everything we can to make sure that we get funding for the life of the strategy. We're very conscious of the amount of investment required over the next 10 years to improve the network, to fund programs. And we put that case forward very genuinely and with a huge amount of strength behind that to gain funding for our programs and to transform the network. So we work on that, but we're not the decision makers, obviously, but we certainly make the case. And we will continue to do that in the strongest possible terms. COVID is showing us how we might leverage off funding packages to achieve road safety outcomes. So we did achieve a $500 million boost for targeted road safety works in the first stimulus package. And we also achieved some community and road safety works for local governments. That was another 500 million. So we got a significant amount of funding for targeted road safety infrastructure works on the back of a stimulus package to improve employment opportunities during COVID. So I think we will use and leverage opportunities along the way, and we will also continue to push for funding for the life of the strategy as we go forward.
Yes, Gabby, I think what we're already seeing is that there's likely to be an emphasis on infrastructure expenditure as a way out towards recovery from the current situation. And if that relates to roads and can be targeted on improving safety outcomes at the same time as meeting other objectives, that's always something we'd hope to encourage. A question from Alan and Laura from Fit to Drive Foundation, who know that drug driving is on the rise. We've certainly seen that in the stats that are coming out. Is this being specifically addressed in the strategy, and what sort of interventions are you considering?
Thanks, Jeff. Thanks, Alan and Laura. It's a significant issue and being dealt with through the National Drug Driving Working Group. So there's been, over time, there's been a significant group that has focused on this and how to achieve really what are the, how are we going to achieve the right types of interventions and programs and testing? It is very much led by my department and the Australian and New Zealand Police Association. So we have a very strong co-chair in Libby Murphy, who is the new co-chair of that group, who's has replaced Mike Keating, who was the previous ANSPAR chair. So together we're working through drug driving as the issue. We know it's an issue. We're trying to understand impairment and levels of impairment. And we think going forward, it's certainly on our radar as an ever increasing issue, as well as you may be aware of certain pushback around having drugs in the system and how to relate that to impairment. It's a question or an answer, or we're still working through how to address this. I think it's a very complex question, and the National Drug Driving Working Group is continuing to push research and understanding of the issue, as well as how to increase testing and get the right tests out, and work from understanding what we need to do as well as an enforcement perspective. So big focus on that going forward.
Thanks, Gabby. Yeah, I think that's an important area. It's very much an issue of driving by drug users as much as it is of drug use by drivers, and the social model that cuts across the other societal processes to reduce the level of drug abuse is inevitably going to have an impact, and perhaps is a necessary precursor to reducing the drug-impaired driving or alcohol-impaired driving on the roads. Just a couple of questions about accountability. If we get 10 years down the track and the strategy hasn't met its objective and metrics, who's accountable for that? And what does accountability look like for meeting targets set in a national strategy of this sort?
Thanks, Jeff. I think accountability has been brought out a number of times in different reviews and different and the inquiry. And I think we're really conscious of our federal system and how do we actually make it work for us rather than work against us. So we're trying to put in governance models now to make sure that we have a clear understanding of what we want to do, how we want to do it, who's going to deliver it, who's going to pay for it, and how will we measure it. So that's a huge task ahead of us, and going to be one of our enabling actions in the first action plan is to address all of these questions and come up with the right governance model. But that's exactly our strongest focus, because we really want to address any perceptions going forward that we will actually be addressing this. I think we all know that we need data to help us with this, and data is a key enabler to not only just understanding the problem, but understanding the effectiveness of change for the measures that we are applying to the problem. So we're going to be using data to help us, and we're also going to make sure that we've got those enabling actions in place, such as how to bring local government in. How do we engage local governments to understand their responsibilities for the network? How do we make sure that they are dealing with road safety issues, not just maintenance issues and asset management issues? How do we make sure that the funding that goes out to programs actually provides road safety upgrades, and that it is applied to those measures and not value managed out? So we're in the process of developing up a framework. I think that will take some time to make sure that the framework is the right one and that it addresses all of these things, but that is absolutely one of our top priorities for the strategy, to make sure that that it's visible, that it's, you know, that everything we're doing is transparent, that why we're targeting what we're targeting, what is the change that we expect to see, who is going to deliver it, how much will it cost, who's going to pay for it, and what can we expect to see as a result of that investment? So it's a really brilliant question, I might say, because that is, I think, what we all understand what we have to do first to make sure that everything that we do and everything that flows from the strategy is appropriately targeted, effective, and cost effective. I hope that answers the question.
Look, that's good. Of course, and leads straight into a question from Sam Doki. To target the interventions to the best outcome, you need to have a source of nationally consistent crash data and information to understand what's going on and measure what impact the interventions are having. Does the office have a role in putting that nationally consistent crash data together?
Thanks, Jeff. Hello, Sam. I feel like I'm on a Senate Estimates Committee at the moment answering their questions. I think the serious injury data is the most vexed question for making sure that we've got nationally consistent data. And that's a project that's been undertaken for some time. We're nearly at the end of stage 2 of this project. A pilot was done to see if we could get nationally consistent data with a national data linkage project for hospitalisations from road crashes. So we know that lots of road crashes are not reported to the police, and therefore those admitted to hospital with a serious injury may not come up in the numbers. So we've been doing a very serious data linkage project to make sure that we understand exactly what the numbers are. And so the pilot was successful to show that this could be done. We're now bringing all jurisdictions along. There is one jurisdiction that is still having some permission problems to enable us to get the data. If we get that data from that jurisdiction by February, we will have a complete and whole national data set of serious injuries, but it may be all bar one. However, we will be able to understand mostly what the national picture is for serious injuries. From that, we will work towards getting and I would expect for the project to be finished. The draft report will be available perhaps around February, and then the final report I would expect mid next year for us to understand then, okay, what is the actual definition we are going to set for serious injuries. So we need to get to the end of this part of the project to have that conversation with all of the information in front of us, and then get jurisdictions all signed up for a national consistency definition. And then I think we also, when we get to that point, we'll look to what's the potential for setting a series of thresholds for the application of countermeasures, and what will we target? Because I think there's a strong push for, while any road crash that causes harm and the effect on that person is what we want to prevent, there is a stronger push to prevent injuries that are lifelong suffering or catastrophic injuries, such as spinal injuries and acquired brain injuries, as opposed to something like a fracture that will keep you in hospital and there will be a recovery period, and you may well suffer for periods of time throughout your life, but it's not the very significant impairment day-to-day ongoing. So I think there is a big push to understand, when we get to that point of stage 2, should we also look for a threshold at where we are trying to focus? What are the crashes we're trying to prevent? Is it those crashes that we focus on first that lead to catastrophic and lifelong injury? So that is something that we will, when we get those reports, we will have a bigger conversation around that. Still a work in progress.
Thanks, Gabby. The source for reliable data has been a work in progress for the last 3 decades at least, probably longer. So I'm glad to see that you're tackling it so thoroughly. is with the available data, are you doing some modelling to inform the sort of targets you're looking to set as interim targets in the next strategy?
Yes, there is some modelling being done, sort of some national baseline prediction modelling, and then what countermeasures will we apply against that. And it's not as far ahead as we would have liked. And we would have liked that obviously far earlier in the year, so that we were had a greater sort of set of, or greater suite of potential countermeasures to take to the consultation. But so that's being done, and it's on track to come within the next couple of months. So it is coming later in the piece than we would have liked. But I think that even though it may not be ready for the release of the strategy, we want the strategy to be live. And we also understand that with our first action plan, a lot of the actions will be enabling actions to make sure these hurdles that have cropped up over time are actually dealt with. And then we have opportunities to be far more agile and responsive to what the modelling tells us in the future.
That's good. And when the modelling is complete, is that going to be published along with the strategy?
I don't know, actually. I haven't applied any depth of thought to that, Jeff. I'm not sure. Couldn't answer that one at this moment.
Okay. All right. Thank you. Now, trying to not sound like a cantankerous senator in an estimates committee. When ministers are looking at the need for road safety to reach beyond the traditional transport solutions, how in practice is the new strategy going to do that?
For ministers, we really want, specifically, ministers at the cabinet table need to get the buy-in of all of their colleagues who have responsibility for other portfolios around the cabinet table. We want people understanding the impact that road trauma causes and the impact it has across society. So we want people to understand that so many things are not within the realm of the Transport Minister. Many things need the buy-in of others. So we know that, such as the serious injury data information, we've had significant difficulties over the years because it's not so much the road transport ministers not wanting a serious definition, but some barriers in relation to our health partners, where the questions of privacy and releasing that data to research institutions has been blocked. So we have hurdles to overcome that are not necessarily within the remit of transport. We know that we have to get buy-in from policing and enforcement agencies. We know that we need issues such as justice and over-policing and incarceration looked at a broader perspective to overcome some issues that affect very particular communities. And we know that we need change across the education portfolio to make sure that, again, road safety is not one of those subjects that is value managed out, but actually embedded into the curriculum, whether it's embedded in maths and science as a topic for one of those core competencies that we would like students to learn. We want to make sure that it's in there and through the life of a child's education. So it's not news to them. And there is, I suppose, less resistance to known road safety solutions. It's part of building cultural change that a lot of these elements are built into everybody's life cycle so that the health injury burden is lessened, and we do that through a number of factors. So we want support for legislative change. We want support for our programs. We want support to do the research. So we need that. We need our ministers to reach across the cabinet table and show their cabinet colleagues how important road safety is to get us to those outcomes.
Right, thanks. And we're in the final minute of the scheduled session. So I might ask one final question. Is the strategy looking at behavioural change on rural roads? Because that's where so much of the problems emerge.
Well, I'd say the strategy is very much focused on regional roads and improving road safety outcomes, but I think we don't want to go down that blame the driver either. So yes, we want behavioural change and cultural change across the country, but we also want change across the network. So how we do that is sort of multifaceted. So obviously we want to improve all driver behaviour. We take that as a given, but we're not necessarily targeting rural or regional drivers as such, and we don't want to go down the track of blaming the driver. We want a network that's self-explaining, that allows a greater margin of error for those people who do make a mistake to recover, and you know, reduce and lessen the impact and severity of injury should a crash occur. So we're very much focused on that and building safe systems into all treatments for any road investment.
Well, thank you, Gabby. I'm afraid, although there are a large number of as yet unasked questions, we might have to leave it there as the time for the session has come to an end. I would like to thank you, Gabby, very much for putting the time in to come on and answer questions so comprehensively on the direction that the Federal Office is leading us to reduce death and injury over the next decade. And particularly, I wouldn't wish a unnecessary extra Senate estimate session on anyone. So thank you particularly for agreeing to endure that. For those out there in the audience who are not currently members of the college, and in response to one of the unanswered questions of how does an individual have input into strategies of this sort when consultation is primarily driven through organisations, one way is to join the College of Road Safety. The URL for membership is on the screen, and the Federal Office will be very happy to tell you how to become a member, the benefits of membership, and put you in touch with the local chapter that can get you involved and connected with road safety professionals, researchers, and policymakers across Australia and New Zealand to make sure that your views and your knowledge of road safety are being heard and conveyed into decision-making processes. So, in closing, I'd like to thank you all for putting aside the time to attend this virtual session through webinar. I would like to thank again Gabby and the staff at the Federal Office of Road Safety for giving up their time to participate, and to thank ARB and particularly Tia Gaffney and Dave McKernan for the work that they've done to set this up and host the session. The recording of the session will be made available after the event, and details for how you can access that will be sent out to everyone who's registered to participate. So do share it around amongst your colleagues and anyone who might be interested to know how we're going to improve road safety over the next decade. So with that, thank you all very much, and look forward to talking to you again at the next event that the college organises.
Great, thanks, Jeff. Thank you to all our presenters today, and thanks to our audience for tuning in. Thank you and have a great day.